Dear Professor Johannes Vester, the Academy for Multidisciplinary Neurotraumatology has reached its 22nd edition, Annual Congress, taking place in a very special location. What is your overall impression of this educational event, and please tell us if it meets your expectations?
Thank you for this question. Yeah, I think we all realized here again the importance of face-to-face communication, to see each other, to look into our eyes. And between so many different disciplines, it's important to connect, to really move things forward and to use the available synergies. And that was fantastic during these days, so important. Think AMN. That was the common experience, and this interdisciplinary sharing of different scientific perspectives in an open, respectful way. And as we do it here, this is a unique approach. And you see how this opens the hearts, the passion, the energy, which we all need to move things forward because it makes sense to think that way. And the living feedback cycle between all of us, between all the disciplines involved in neurotrauma, that's opening our mindset to a broader understanding of the really complex nature of neurotrauma. That's complex, especially traumatic brain injury. And also for developing successful new treatment concepts. That's only possible by putting all these different aspects together to a holistic approach. That's Think AMN.
Thank you so much for your answer. And now, in your capacity as president of the Academy, what do you consider to be your best accomplishments of your term?
Good question. Yes, there are several of them. Well, for me personally, if you ask me, it's the further evolution of the AMN from a multidisciplinary starting base at that time when it was founded to a multidimensional society. You know, in medicine, there's no truth carved in stone. Medical state of the art is a snapshot. It changes with every new piece of research, of deeper understanding of the complex interdependencies. We always have to stay open, to learn from each other, to stay flexible in our mindset for new developments. And, very important, neurotrauma needs not only a multidisciplinary approach, it needs a multidimensional approach, because neurotrauma is multidimensional from its very nature.
Yes. Can you please explain a bit the difference here?
Yes, my pleasure. What's the difference? A multidisciplinary approach refers to the involvement of professionals from multidisciplines who work collaboratively, often independently, to treat the patient. Each specialist contributes his own expertise: neurosurgeon, neurologist, neuropsychologist, physical therapist, speech therapist, psychiatrist, and so on. So it's discipline-oriented. A multidimensional approach is patient-centered. That's something different. It refers to the evaluation or treatment of a condition across multiple domains or dimensions of functioning. So it focuses simultaneously on the various dimensions of the patient's conditions like motor, cognition, emotion, communication, social integration, all these aspects, quality of life, we have to see at the same time to find the right approaches. So we don't stay with the concentration of our discipline. We offer our discipline for this holistic approach. But our heart is patient-centered. That makes the big difference between multidisciplinary, multidimensional. And AMN, as the Academy for Multidisciplinary Neurotraumatology, is dedicated to open the mindsets to this enlarged approach to communicate the breadth of multiple perspectives simultaneously, so necessary to capture the whole picture of neurotrauma and recovery. And that's really new this way, and it was also extremely appreciated by the participants in this Congress. That's Think AMN.
Thank you so much, Professor Vester, for this very comprehensive explanation. This year's Congress brings forward several developments pertaining to the new vision and mission of the Academy for Multidisciplinary Neurotraumatology. Could you elaborate on future perspectives related to those?
Yes, of course, there are some important new developments, and I think maybe one of the most important is the establishment of so-called focused groups, focused AMN groups. You know, the AMN is like a center, like a brain, like a quantum energy putting all these things together. But why? It's for the patient there, and he is locally in a certain country, in a certain hospital, with certain people working there. And so the focus groups are committed to and build in a certain country because they deal with the local constraints, with the local conditions. They have to be creative, how to implement Think AMN in this country. And this can be a different challenge than implementing Think AMN in this country. So also the feedback from these focus groups will help each other because they develop some fantastic ideas how to deal or with the governmental support, and that can help other countries. So again, that's the focus now on the patient, which is by very nature in a certain location. So focus groups are even one step further on to establish that Think AMN in real life, in real world situation, and to learn from each other in these countries. So, and I'm very happy that we already have 6 countries who said, we want to enter this, we want to contribute, we want to implement the AMN thinking in our country with this spirit and implement all this for the benefit of future patients. So that's a great success that we already have this dedication, because it's also work, you know, to follow the spirit, to implement, to have ideas and to share these ideas with other countries and other focus groups. So it's a big step forward for implementing all this in the countries.
Indeed, it is a very good achievement, and the Congress is not even over. So hopefully we will have more focus groups to be announced by the end of the event. And finally, Professor Vester, as a highly acclaimed expert in biometrics, please share with us the essence of the multidimensional methodology in evaluating international clinical trials.
Thank you for these questions, and I will tell you the essence is exactly related to what I said before, the multidimensional approach. If we want to capture the whole picture of the development of the recovery of a patient after neurotrauma, cognitive, emotional, this, physical, and many, many different aspects, we need the statistical procedures to deal with this, to also there have simultaneous procedures. And if I look back, like decades ago, there was only one outcome, that was the Glasgow outcome scale, split into 2 pieces, favorable outcome or unfavorable outcome. So every patient was just considered as favorable or not favorable. There was nothing in between. So that's like looking only in black and white, in good and bad, no differentiation by this. So what a different world is to capture the full scales in cognitive, physical, emotional, social recovery, and at the same time to capture the full picture of the outcome of the patient. And the statistical procedures for this, fortunately, are available. The big breakthrough was in 2010 about with the impact recommendations that we cannot continue research like this with the statistical old procedures, just with good and bad, black and white. We have to have multidimensional procedures. And the European Medicine Agency made workshops on this, that we need simultaneous correlation-sensitive spread of outcome to capture the breadth of neurorecovery. And the International Biometrics Society made then teaching course. I was participating on that to teach other statisticians on these procedures, just to name the gold standard, which is called the Weilachin procedure, which works with full scale, simultaneously providing the test results as we expect for evidence-based medicine. So also there is a big breakthrough from a statistical point of view, And also AMN is encouraging this. We make trainings on this because otherwise we have nice ideas, but we cannot implement them in evidence-based research. But now it's happening and it already is implemented successfully. Just to mention the Captain series of trial, which showed the immense power of this new approach.
Thank you very much, and I wish you all the best in all your endeavors.
Thank you very much. It was my pleasure.